It gives us great pleasure to present to you the 2021 Academy of Consultation-Liaison Psychiatry's annual awards. Let's get started by welcoming our new 2021 Academy Fellows. Fellowship is awarded to members certified in CL Psychiatry or who have completed a combined residency and who have made exemplary contributions to our field and to the Academy. This year's new fellows are Omer Abbasi, Joseph Saramelli, Dustin DeMoss, Anna Dickerman, Margot Funk, Alan John Shue, Ellie Eisenberg Grisetta, Sheila Lahijani, Robert Lloyd, Curtis McKnight, Shamim Nejad, Eva Isle, Dirga Roy, Dahlia Saad Pendergrass, Katie Lalone, Scott Simpson, Jane Walker. Our congratulations to you all. Next, we have our Webb Fellows Awards. Each year, the Academy selects a small number of outstanding residents and fellows for the William Webb Fellowship Program. The program is named after William Webb, Jr., a past president of the Academy, and aims to foster future leaders in CL Psychiatry by providing mentorship and networking. Well, I'm delighted to announce this year's Webb Fellows. Andrew Drysdale, New York Presbyterian Columbia University Medical Center. Amanda Mahalik Winger, University of Florida Health, Psychiatry. Charles Masaki, Massachusetts General Hospital. Molly Howland, University of Washington. Artin Madanian, Johns Hopkins University. Christian Bier Rial, Memorial Sloan Kettering Hospital. Congratulations to the 2021 Webb Fellows. Our next awards relate to papers published in our journal, the Journal of the Academy of Consultation-Liaison Psychiatry. The Dorfman Journal Paper Awards are named after our journal's founding editor, Dr. Wilfred Dorfman, and are awarded for the best articles published from July 2020 to June 2021. This year's award for Best Case Report goes to Stephen Ferrando and colleagues for the paper COVID-19 Psychosis, a potential new neuropsychiatric condition triggered by novel coronavirus infection and the inflammatory response. The award for Best Original Research Paper goes to Jose Galucci Neto and colleagues for the paper Ictal Spect in Psychogenic Non-Epileptic and Epileptic Seizures. And the award for Best Review goes to Deirdre Caffrey and colleagues for the paper Stiff Person Syndrome and Psychiatric Comorbidities, a Systematic Review. Now we have the award for the best paper submitted to the CLP 2021 meeting, the DeLynn Fisher Clinical Research Award, named after Barney DeLynn and Keith Fisher, both past Academy presidents and frequent research collaborators. This year's award goes to Vishal Ahuja of the Southern Methodist University Cox School of Business for the paper Impact of Co-Locating Mental and Behavioral Health Providers with primary care providers and specialists on patient outcomes, which you can find in our content library. Next, we have the pleasure of presenting the Don R. Lipset Award. This award is supported by the ACLP Foundation and recognizes special achievements in integrated and collaborative care, a topic long championed by Dr. Lipset. This year's Lipset Award winner is Jamie Belsito of the Maternal Mental Health Leadership Alliance, who presented a lecture titled A Patient's Perspective, which you can find in our content library. Now, a few words from the winner's nominator, Dr. Nancy Byatt.
Hi, I'm Nancy Byatt, and it's a deep honor and privilege today to present Jamie Zalway Belsito with the 2021 Don R. Lipset Award for Integrated Care. I've known Jamie for a really long time. Jamie and I first met in the state of Massachusetts when we were 15 years ago now, trying to figure out how can we address maternal mental health across the state of Massachusetts, and how can we increase access to care for all the individuals struggling with untreated perinatal mental illnesses. And we at the time had a vision and a dream really to create the MCPAP for Moms program, which is a statewide program that aims to increase access to care by building the capacity of frontline medical providers. Jamie made that dream a reality in working with the Postpartum Depression Commission in Massachusetts. She was able to, with all of the many advocates on the commission, get funding for this statewide program, which has now served over 12,000 women since that time. Not only did she do that, but once the program was successful, Jamie then worked with the federal legislature nationally and with Congresswoman Catherine Clark to get funding for programs like it across the country. That funding was appropriated, and there's now grants funded through HRSA for these programs across the US. These programs now collectively cover 1.7 million, or 45% of the births across our country. So Jamie's really a tireless advocate, policymaker, and person with lived experience who has really just taken her personal experience of lived postpartum depression along with her expertise in advocacy and policy to make major changes across our field. I can't think of anyone who has made more changes in the field of maternal mental health and integrated care than Jamie. Recently, she also was able to get legislation passed for $3 million for a maternal mental health hotline where patients themselves can call for support. That hotline will start next year. So it's really, truly an honor and a pleasure. Jamie, you're a valued colleague and friend, and it's such a pleasure and honor to present this award to you. I'm very grateful for all the work that you do. I know all of us who practice in the field are, as most importantly are all the individuals for the advocacy and the programs that you've helped fund, serve, and help. So congratulations, Jamie. It's a pleasure to be presenting you with this award today.
Congratulations, Jamie Belsito. Our next award is the Wayne Caton Research Award, which recognizes exceptional research in CL psychiatry. It is in memory of Wayne Caton, a past Academy president, a dedicated clinical researcher, who is considered the father of the collaborative care movement. This year's winner is Sir Simon Wesley, Regius Professor of Psychiatry at King's College London. Now, a few words from the winner's nominator, Dr. Michael Sharp.
Hello, my name is Michael Sharp. I'm a previous president of the Academy, but I'm here today to be able to introduce this year's Academy Research Award winner, who is a colleague of mine, I'm pleased to say, called Professor Sir Simon Wesley. So why was Simon nominated for this position? Well, he is a preeminent academic CL psychiatrist. He's been hugely prolific, and he is, as I think you'll see on his lecture, also very successfully persuasive. When I say he's preeminent, he has done very important work on the understanding of symptoms, particularly unexplained symptoms, on the psychiatric aspects of serving in the military, and of the effect of trauma on the military and indeed on civilians, and various combinations of these topics. When I say he was prolific, he has published more than 500, yes, you heard that, 500 peer-reviewed papers. And not only has he done research, he has been persuasive in public life and had the findings of his research implemented in different ways, including influencing the care of our soldiers in the UK and also in the US military through his work on trauma, preparing for trauma, and helping soldiers after they leave the military. For all this work, he has been knighted by the Queen, so he's Sir Simon Wesley, and more recently, he's been elected as a Fellow of the Royal Society. You may not know what that is or what it means, but this is an award given to a very select group of scientists in Britain, and indeed the Commonwealth, as they say, for people who are really outstanding in their field, and that's a very great honour. So I am very pleased that Professor Simon Wesley is the winner of the Wayne Caton Research Award of our Academy for 2021. Congratulations, Simon.
Congratulations to Sir Simon. The next award is the ACLP Foundation Research Professor Award. This award recognizes a preeminent research leader and invites them to lecture at the annual meeting. Awardees share their knowledge and experience with other researchers and provide ongoing mentorship to early career researchers. This year's Research Professor Award goes to David Arciniegas, Professor and Senior Research Neuropsychiatrist at the University of New Mexico School of Medicine. Now, a few words from the winner's nominator, Dr. Davin Quinn.
Hello, I'm Davin Quinn from the University of New Mexico, and it is my pleasure to introduce Dr. David Arciniegas, the 2021 winner of the ACLP Foundation Research Professor Award. I've known Dave for over a year, and I nominated him because of three reasons. First, he's incredibly knowledgeable. Dave knows a thing or two because he's seen a thing or two. Whether he's consulting on a case or delivering a didactic, or you're reading one of his meticulously researched and edited articles or textbook chapters, it's clear that he knows all of neuropsychiatry inside and out. It may be related to strokes or TBI or epilepsy or neurodegeneration. Dave always has something new to teach us. Second, Dave is compassionate. He truly has a heart of gold, and he feels for his trainees, colleagues, fellow educators, fellow researchers, because he himself has been through what they have been through. He is attuned and listens to what you have to say, and he's able to give the support that you needed just when you need it. And finally, neither of the first two qualities would make as much impact as they do if not for Dave's generosity. He is generous to a fault, with his expertise, with his time, with his attention, with his funny anecdotes and stories, and with his personal life, with his invitations to go grab something to eat and catch up. So Dave Arciniegas is a true treasure and resource, and his involvement with ACLP will no doubt help to develop the upcoming generation of physician scientists in our fields. I'm positive this year's Mentorship Award winners will get a great deal out of their time with Dave, and it's my not-so-secret hope that his involvement and influence will help us to increase the collaborations between neuropsychiatry and consultation-liaison psychiatry. Thank you, Dave, for all that you have done, and thank you, ACLP, for recognizing Dr. Arciniegas with this honor.
Congratulations, Dr. Arciniegas. The research professor also provides mentoring to 3 research mentees over the coming year. This year's Research Mentee Award winners are Erica Baller, Elizabeth Prince, Melissa Bowie. The Eleanor and Thomas P. Hackett Memorial Award is the Academy's highest honor and is presented to a member who has demonstrated distinctive achievements in training, research, clinical practice, and leadership. The award is named after Thomas P. Hackett, a longtime leader in the field of CL psychiatry, and his wife, Eleanor. The 2021 Hackett Award winner is Dr. James Bourgeois, of Baylor Scott and White Health Memorial Medical Center, Georgetown, Texas. Dr. Bourgeois is the author of over 200 peer-reviewed publications and author or editor of over 50 books or book chapters. He has held previous academic appointments at the University of California, Davis, University of Texas Health Sciences Center at San Antonio, and McMaster University. He is Professor Emeritus at University of California, San Francisco, and Adjunct Professor at Uniformed Services University of the Health Sciences. Dr. Bourgeois presented the Hackett Award lecture earlier today with a personal introduction by his colleague, Dr. Gerald Kay. If you missed the lecture, the recording is available in our content library. Congratulations, Dr. Bourgeois. We next present the Award of Special Recognition. This is awarded to individuals for outstanding service to the field on a local or national level. This year's award winners are Dr. Jessie Fan of University of Washington and Dr. Jane Walker of University of Oxford, bestowed in recognition of their outstanding efforts and tireless commitment to making last year's annual meeting, CLP 2020, a huge success, despite the difficulties thrown in their path by the pandemic. The Academy is very grateful for your personal efforts, Drs. Fan and Walker. This award is much deserved. The next award is the Studemeyer Innovations in Education Award, which is given in recognition of a CL Psychiatry educational program directed at any level, from medical students to CL Psychiatry Fellows, that is outstanding by virtue of its creativity, innovation, and impact. This year's winner is Scott Simpson of Denver Health Medical Center for his educational initiative, Verbal De-Escalation of the Agitated Patient Online Curriculum. Congratulations, Dr. Simpson. A thank you to the Academy's longest-standing members. Before we draw the awards ceremony to a close, we would like to take a moment to acknowledge the Academy's longest-standing members. Thank you to Drs. Howard Kurland, Richard Chesick, Harold Goldberg, Nicholas Stratus, Richard Rada, Gary Nye, and Russell Noyes for being Academy members for over 45 years. Congratulations to all the ACLP 2021 awardees. We look forward to presenting the 2022 awards in person in Atlanta, Georgia. We hope you'll join us.
Mike Marcangelo, and on behalf of the Brief Oral Presentations and Posters Subcommittee, I am pleased to present the awards for Best Posters for ACLP 2021. There were over 190 posters accepted this year to the conference, and the work demonstrates the breadth and depth of our field. The committee worked all year to evaluate the quality of poster submissions and, more recently, to examine posters that were submitted in advance in order to determine which combined quality of research, clarity of communication, and visual appeal most successfully. I'll start with the winners of the Best Posters General category. The third place award goes to Collaborative Care Service for Psychiatric Disorders in a General Hospital Emergency Department. What has changed in the patient's profile in the context for COVID-19 pandemic? Presented by Dr. Adriana Bueno and colleagues from the Federal University of Sao Paulo, Brazil. Their poster explores how patients presenting for emergency psychiatric care during the pandemic changed and provides helpful perspective on who was treated and, as importantly, who was not. Congratulations to Dr. Bueno and colleagues. The second place award goes to a descriptive analysis of pharmacological management of aggression and/or agitation in patients with traumatic brain injury in a Southwest Virginia inpatient population, presented by Dr. Elam Rahmani of East Carolina University, along with colleagues from the Virginia Tech Carilion School of Medicine. Their work examines medications used to manage behavioral problems in an acute hospital setting. They find that non-recommended medications are used more often than recommended ones and provide suggestions about how to improve this gap between evidence and practice. Congratulations to Dr. Ramani and colleagues. And the first place award goes to the effect of agitation on the sensitivity of the Columbia Suicide Severity Rating Scale Screener to suicide risk after emergency department visit, presented by Dr. Christian Goins and colleagues from University of Texas Southwestern and others from Colorado. Their poster finds that adding a measure of agitation to the Columbia Suicide Severity Scale improved detection of suicidality over the next 3 months. Congratulations to Dr. Goins and colleagues. Next, we will present the awards for Best Trainee Poster. The third place trainee award goes to Expanding the Role of Psychiatrists to Increase COVID-19 Vaccination Rates in Clozapine-Treated Patients with Serious Mental Illness, a Quality Improvement Study, presented by Dr. Carol Lim and colleagues from the Massachusetts General Hospital. Their poster examines efforts at the Freedom Trail Clinic to encourage vaccination among people in the community with severe and persistent mental illness and found great success utilizing motivational interviewing and related techniques. Congratulations to Dr. Lim and colleagues. The second place trainee award goes to Mortality among patients with sepsis associated with a bispectral electroencephalography score, presented by Pedro Mara for work he has done in Dr. Jen Shinazaki's lab at University of Iowa. Of note, Pedro is not a fellow, a resident, or a medical student, but an undergraduate research assistant. Their poster presents data on the use of bispectral EEG in critically ill patients and found that high scores during the first study predicted elevated mortality in patients with sepsis. Congratulations to Pedro and colleagues. And the first place trainee award goes to Impact of COVID-19 Pandemic on the Prevalence of Substance Use Disorders in Medically Hospitalized Patients, presented by Dr. Kelsey Collins and colleagues from the New York University Grossman School of Medicine. Their poster presents data about shifting patterns of substance use detected with their proactive screening tool and finds higher rates of opioid use and high-risk alcohol use during the pandemic. Congratulations to Dr. Collins and colleagues. Finally, the award for Best Case Report goes to Successful Resumption of Clozapine with Immunosuppressants in Liver Transplantation, Case Report and Review of the Literature, presented by Dr. Alan Y. and colleagues from University of Toronto. Their poster describes a patient on clozapine who required close monitoring after liver transplantation and ultimately did well medically and psychiatrically. Congratulations to Dr. Y. and colleagues. I'd like to thank all the members of the brief oral presentations and poster subcommittee for their work evaluating the submissions. Once again, congratulations to the awardees.